By the end of this video, you will be able to define what critical thinking is, apply critical thinking to a clinical-based scenario, be able to use a critical thinking flowchart.
Hi, I'm Sandra. I'm a dietetics intern and I've just started my first clinical rotation. I've been asked to consult with my first patient. I'm feeling very nervous.
Mr. Tomei is 72 years old and was admitted to hospital from a long-term care facility. He has rapid weight loss that occurred recently, and his blood work shows he has hypercholesterolemia. Sandra has been asked to assess the patient and develop a plan of action. To do this, she will need her critical thinking skills. Critical thinking involves analyzing and evaluating the situation in order to make a decision. Let's go through the critical thinking flowchart to help Sandra out. These are questions Sandra can use to critically think through her situation. Step 1. What do I know?
What do I know about the situation? Are there any consequences of malnutrition? What are the implications of high cholesterol? Here's what I know.
Step 2. How do I know?
How do I know the information I have is correct, and that the sources of information are reliable? Am I biased or making any assumptions? This is what I came up with.
Step 3. What is important?
What is important to Mr. Tomei and his recovery? What's the priority?
Why did Sandra choose malnutrition? Although it is important to manage high cholesterol, at this point in time, it does not pose an immediate risk. There are more immediate complications with malnutrition that need to be addressed first. Step 4. What is missing?
What is missing from the information I have about Mr. Tomei and in my understanding of his condition? Here's what I need to find out. After my investigation, here's what I discovered.
Step 5. What is my plan of action?
What is my plan of action? What are my next steps? Here's what I'll recommend.
Hey Sandra, your patient's weight has improved and the physician has approved his discharge. Good job!
Step 6. How did I do?
How did I do? How do I think that went? Here's what I did well. Here's what my preceptor said I could improve upon. Here's what I think I could have done differently. Now that I know how to use the critical thinking flowchart, I'm ready for my next patient. Woohoo!
Created using Powtoon.